So in this lecture we will see drug acting on CNS, and we'll try to finish at least general anesthetics. So welcome, and in this session we will see drug acting on CNS. There are numerous chapters which are there in this section, drug acting on CNS. So general anesthetics is there, sedative hypnotics, general anesthetics, sedative hypnotics, anti-epileptic drugs are there, antipsychotic drugs are there, then drug used in the Parkinsonism, drug used in the Alzheimer disease, CNS stimulants drug, hallucinogens. There are the names of chapters like general drug acting on central nervous system. So there are numerous chapters under this heading. So in this narcotic analysis is also there. All narcotic analysis like morphine, codeine, thevenin, papaverine, narcotin, then meperidine, ketamine, and all that. So all the habit-forming drugs. So narcotic analysis. Narcotic means producing sleep. Any agent if is able to produce sleep and habituation, it is a narcotic. Analysis means to relieve the pain. Then anxiolytics are there, sedative hypnotics are there, then anticonvulsants are there, then general anesthetics are there. So out of these, then antipsychotics drugs are there. These drugs comes under the heading of drug acting on CNS. There is one separate section on pharmacology in the pharmacology as well as medicinal chemistry for these chapters. So drug used in the Alzheimer's, then drug used in the Parkinsonism, antipsychotic drugs, general anesthetic, anticonvulsant, narcotic analgesic, sedative hypnotics, anti-anxiolytic, then again local anesthetics. So these are the drug acting on CNS. So out of that we are going to see general anesthetics, okay, CNS stimulant, local anesthetic. So before starting the drug acting on CNS, you should know how there is excitability of neuron and how what is the process through which there is neuronal excitation. Neurons में excitation कैसे होता है? How there is a generation of impulse or how there is a transmission of it. So for that you have to understand. So most of okay. So neuronal excitation or excitability of neuron depends on the influx. Excitability of neuron depends on the flux of ions in the neuronal membrane through ion channel. So neurons में different ion channels होते हैं, जैसे sodium ion channel. The entry of these cations inside the neuronal cell membrane causes depolarization and there is initiation of your nerve impulse and then it is conducted. So obviously if there is an entry of sodium, that is known as a sodium influx, or exit of potassium, that is known as a sodium efflux. So entry of sodium or exit of sodium from the cell, okay, entry of sodium inside the cell or exit of potassium outside the cell. So that stimulate the neuron or excite the neuron due to depolarization. So entry of sodium inside the neuronal membrane, that will cause depolarization, and exit of potassium from the neuronal membrane to the outside also will leads to depolarization that stimulate or excite the neuron. So entry of sodium or exit of potassium both causes depolarization and excitation and stimulation of the neuron. Then entry of chloride, that is chloride influx, and again exit of potassium, that is a potassium efflux, leads to hyperpolarization of postsynaptic membrane, and that leads to inhibition or depression of action, inhibition of impulse or inhibition of generation, inhibition of conduction of impulse और डिप्रेसिव एक्शन. सो स्टिमुलेंट एक्शन कब होगा आपका? न्यूरॉन कब एक्साइट होगा? जैसे कैटायन बाहर से अंदर जाएगा या फिर अंदर का जो है उसका इंटरसेलुलर कैटायन पोटेशियम वो बाहर आएगा, तो क्या होगा? उसका जो इनसाइड मेम्ब्रेन इनसाइड पोटेंशियल होता है -70 मिलीवोल्ट, वो क्या होगा? डिस्टर्ब हो जाएगा. दैट इज कॉल्ड एज डीपोलराइजेशन. That leads to stimulation or action. And if chloride ion influx or chloride goes inside the cell or potassium leaves the cell, in the both cases what happen inside the cell, there is an increase in the negative potential that leads to hyperpolarization of neuronal membrane and it causes depression or inhibition of action. So there are different kind of ion channels. They are either voltage gated ion channels, okay, voltage gated ion channels changes in the membrane potential. Axonal axon जो होता है न्यूरॉन का, axonal sodium channels for propagation of impulse, presynaptic calcium channel for release of neurotransmitter from synaptic vesicle. There are different type of ion channel, voltage gated and then receptor bound or transmembrane transmitter receptor gated or receptor bound ion channels. For example, G protein coupled receptor bound ion channel For example, GABA gated chloride ion channel. That is an example of transmitter or receptor gated or regulated neurotransmitter interaction. So what happens in this case? Transmitter receptor gated. So there are two kind of ion channels in the brain. First one is a voltage gated. So through which sodium enters in the axonal axon. These type of channels are present in the axons of neuron. So there sodium will enter and cause depolarization of other ions. So particularly calcium channels, they are present in the presynaptic vesicle for to release the neurotransmitter. Calcium will go inside the synaptic vesicle and it will release the neurotransmitter by exocytosis. Then again, transmitter or receptor gated or regulated neurotransmitter. So neurotransmitter will interact with their respective receptor linked ion channels. Then will be came in a picture. Then will be activated. So they will via secondary messenger. So there are two kind of channels, ion channels, voltage gated one and their membrane or receptor bound. So you can see over here voltage gated ion channel. For example, sodium in axonal membrane and calcium channel, they are present in the presynaptic vesicles. They are blocked by anesthetics and anticonvulsants. So there is a one target for anesthetics and anticonvulsant. So voltage gated sodium ion channel. For example, you can see over here. So this is your neuronal membrane and this is ion channel. So it is a voltage gated ion channel. Voltage gated ion channel. So sodium will move from external to internal. This is the external. Sodium will go inside and cause depolarization and there is generation of impulse. Okay, this is the voltage gated. Then neurotransmitter regulated ion channels. So direct coupling like neurotransmitter like GABA A, glutamate, glycine, ACH target for some second type of ion channel. So neurotransmitter regulated ion channels means, for example, gamma aminobutyric acid, which is the inhibited neurotransmitter in the brain. So it will be released in the synaptic vesicle. It will go on post-synaptic cell. It will interact with its receptor GABA A, GABA B. So GABA A is a chloride gated ion channel. So GABA gated ion channel. So that is example. Okay. So that is again a, for example, in this case, drug will acquire this. So yeah. So it will activate G protein. Neurotransmitter will be interacted with the receptor. Yeah, this neurotransmitter will interact with the receptor, and then it will cause inflow or influx or outflux, influx or efflux of various kind of ions. जैसे GABA, GABA क्या करेगा, यहाँ से क्लोराइड आयन को ज़्यादा मूव करेगा इनसाइड. So there will be hyperpolarization and inhibition. So there are another kind of neurotransmitter regulated ion channel with G protein coupled receptor. So for example, acetylcholine receptor, then dopamine, noradrenaline, OEST, endorphins. These neurotransmitters are also a target for analgesic, antidepressant, antipsychotic, and anxiolytic. For example, you can say over here. So neurotransmitter will interact with the receptor. Then G protein coupled will be activated. G protein coupled receptor will be activated, and then there is a generation of secondary messenger like cyclic AMP, inositol phosphate, diacylglycerol, calcium. It will cause phosphorylation of protein, and this phosphorylated protein will either inhibit or increase the ion to go inside or outside. And in this type of receptor, they act for a long term. Okay? The repeat last for long term. So there are these kind of ion channels. So I will explain it again. So first one is a voltage gated. First one is known as a voltage gated. So suppose that here is a sodium. It is outside. Okay, it is outside, and this part is inside. It is a outside. Now voltage gated channel, sodium will move from outside to inside, and it will cause depolarization. There is generation of impulse and all that. And suppose that chloride goes inside from this ion channel. Chloride will go outside inside. So there will be hyperpolarization of post-synaptic membrane, and there is a inhibition of action here. Inhibition. Now this is a voltage gated ion channel. Now, second type is nothing but the neurotransmitter regulated. Second type is a neurotransmitter regulated. So what happened in this case? Neurotransmitter will be released. For example, this neurotransmitter will be released, and it will activate the activation of receptor will causes either entry or exit of various ions. Suppose sodium will go inside, again there will be depolarization and excitation. Okay. And suppose chloride goes inside, so there will be inhibition. So these are the neurotransmitter gated or regulated ion channels. Okay. Then third kind is nothing but the third type is nothing but the again neurotransmitter regulated but G protein coupled receptor. So neurotransmitter regulated ion channels with the G protein coupled receptor. For example, receptors of acetylcholine, noradrenaline, dopamine, 5-HT, endorphins. So they are also targets for some drugs. So voltage gated ion channels, they are the targets for some anesthetic agent and some anticonvulsant drugs. Neurotransmitter regulated ion channels, they are the also target for some anticonvulsant drugs and then sedative hypnotics and cholinergic drugs. Then again neurotransmitter regulated GABA gated ion channels. So they are also a target for antidepressant analgesics, antipsychotics, and anxiolytic. Okay, now you can see over here, third type, neurotransmitter will be released over here. It will activate the receptor, which is a G protein coupled. So activation of G protein, and there is generation of secondary messenger, like cyclic AMP, inositol 3 phosphate, diacylglycerol, and calcium. So these will cause phosphorylation of, so this will cause phosphorylation of this phosphorylated protein. Now they can cause either activation or inhibition of ion channel. इसके बाद में क्या होगा, यहाँ से एंट्री होगा सोडियम का या फिर पोटेशियम का या फिर कैल्शियम का जो भी आयन हो. And the effect of these kind of receptor, they last long, means they are long, the effect will be lasted for longer time, long term effect. These are the types of ion channels. Secondary messengers involved in this, they are nothing but the cyclic EMP. Cyclic EMP means cyclic adenosine monophosphate, inositol 3 phosphate, diacylglycerol, calcium. Remember over one thing here, these voltage gated ion channels, they act in a fraction of millisecond. It was question in GPAT. Fraction of millisecond. Voltage gated. They are the fastest acting. Millisecond में act करते. Remember these things. There are three kind of ion channels. First one is a voltage gated. Second one is a neurotransmitter regulated. And third one is a again neurotransmitter regulated, but which are coupled with the G protein coupled receptor. These are the targets for your different kind of drugs. So you will see here neurotransmitter and their mechanism. So you have different kind of neurotransmitter in your brain, nature and mechanism. So first one is known as a glutamic acid. It is a amino acid. Okay. So it is a stimulatory and it increases the influx of cations. It is a stimulatory neurotransmitter in the brain. So it has its own receptor. हर एक इसका neurotransmitter का उसका खुद के receptors होते हैं. So this glutamate is nothing but the excitatory or stimulatory neurotransmitter. It increases the influx of cation, influx of sodium or calcium, or it is directly coupled, or it may be either voltage gated, its receptor may be either voltage gated ion channel G protein coupled receptor. For example, NMDA, N-methyl D-aspartate. N-methyl D-aspartate is a target for ketamine. N-methyl D-aspartate is a target for ketamine, is a NMDA antagonist. The next neurotransmitter is GABA, gamma amino butyric acid. So it is an inhibitory neurotransmitter. It increases the chloride influx or potassium efflux. So direct coupling with ion channels. It has a direct coupling with ion channels, and level is increased by sedative, hypnotics, anticonvulsant, and some skeletal muscle relaxants. So its level is increased by these drugs: sedative, hypnotics, anticonvulsant, and some muscle relaxants. And next one is acetylcholine. It is a neurotransmitter for cholinergic system. Its receptors are like muscarinic receptor and nicotinic receptor. Now, out of these receptors, muscarinic receptor are M1, M2, M3, and nicotinic receptor are N, N, and NN. So, nicotinic receptor. Muscarinic means M1, M2, M3. So, out of these receptors, some are stimulatory and some are inhibitory. So, M, for example, acetylcholine, M1 receptor of acetylcholine is stimulatory. It is a it decreases the calcium efflux via secondary messenger like DAG and okay. M2 is inhibitory. M2 receptor inhibitory that increases the potassium efflux via cyclic AMP. Nicotinic receptor is a stimulatory. It increases sodium influx. Target for these acetylcholine receptor are target for nicotine. Then acetylcholinesterase inhibitor. Drug is the anti-Parkinsonism and drug is in the Alzheimer disease. So it is a target for these kind of drugs. So next one is dopamine. Dopamine is again inhibitory receptor. Subtypes are coupled with the G protein coupled receptor. Dopamine receptor also there are different dopamine receptors like D1, D2, D3, D4, D5. Then noradrenaline. It is a adrenergic nerve. It is a neurotransmitter. It is a neurotransmitter for adrenergic nervous system. Adrenaline or noradrenaline will have different receptor like alpha receptors and beta receptor. So alpha are further divided into alpha 1, alpha 2. Out of that, alpha 1 is stimulatory, alpha 2 is inhibitory. Then again there is a beta 1, beta 2, beta 3 receptor. So beta 1 is a again stimulatory, beta 2 is inhibitory, and beta 3 has a mixed action. They have different receptor. So these neurotransmitters will have different receptor. They might be either stimulatory or next one is so noradrenaline is stimulatory or inhibitory. Noradrenaline is speeding up on secondary messenger, and is modified. Its level are modified by different drugs like CNS antidepressants, some anxiolytics, some antihypertensive drugs also. Next one is serotonin, or it is known as a 5-HT. Okay, 5-HT. So different receptor like 5-HT1, 2, 3, 4, 5. So stimulatory, it is a maximum time. Again, it is a mixed stimulatory as well as inhibitory, and depends on the pre-receptor subtypes and secondary messenger. So out of that 5-HT1, 2, 3, 4, 5. Out of that 5-HT3 जो है, that is a ion channel. Out of this 5-HT3 is a ion channel. This was again a question. One of the following serotonin receptor is a ion channel. So 5-HT3. It is a target for stimulant drug, antidepressant drug, anxiolytic drug, and some anti-emetic drug. Then next one is endogenous peptide. Endogenous peptide. So it is again inhibitory. There are subtypes of this receptor. This endogenous peptide, they couple with the secondary messenger, and they are the targets for opioid analgesics. So narcotic analgesics के लिए ये target है. So these are the different kind of neurotransmitters present in the brain, their nature and their receptors. They are the target for certain drugs. Different neurotransmitter distribution and effect. Now, these neurotransmitters are classified according to their nature, according to their chemical. First class is nothing but your amines. So they are amine in nature. First class is they are amine in nature. There is amine. For example, acetylcholine is there. Your noradrenaline, then dopamine, pyridostigmine, histamine. So all these are the amine in nature. ये जो है इनका nature amine है. Here acetylcholine is distributed. Acetylcholine is found in all region of CNS, predominantly in the cerebral cortex, ascending reticular system and cerebellum and spinal cord. So throughout the CNS, it is both excitatory as well as inhibitory in nature. It is both stimulatory as well as inhibitory in nature. Acetylcholine, noradrenaline, adrenaline, histamine, serotonin. These are amine in nature. Okay. So this out of this acetylcholine we have seen distribution of acetylcholine. So it is both stimulatory as well as inhibitory depending on its receptor. I have told you acetylcholine will have different receptors like muscarinic receptor and nicotinic receptor. Muscarinic receptor में M1, M2, M3 आता है. Nicotinic में M आता है, N आता है. Noradrenaline. So it is also found in the brain, hypothalamus, limbic system, reticular formation, and brainstem. Also has a both kind of it has a two type of receptor, alpha and beta. So in alpha, alpha 1, alpha 2, in beta, beta 1, beta 2, beta 3. Their distribution is different. So beta 1 is receptor in the beta 1 is found in the heart. Beta 2 receptor is found in the bronchial smooth muscle. Beta 3 receptor is found in the adipose tissue. So that distribution we are going to see again whenever we will see adrenergic drug. Whenever we will see cholinergic drug, at the time we will see the distribution of muscarinic and nicotinic receptors. So just remember it will also have both excitatory as well as inhibitory. Now dopamine, so it is found in the basal ganglia, median emanations of hypothalamus and adenohypophysis, frontal cortex, that part of brain. So dopamine containing neurons. So it is again inhibitory in action, and deficiency causes disturbances in extrapyramidal disturbances. Means deficiency causes Parkinsonism. Deficiency causes Parkinsonism. Okay. Next one is a 5-hydroxytryptamine, AST, or it is also known as serotonin. It is also again a amine. So it is found in the cerebral cortex, raphe nucleus, and hippocampus area. It also has a both excitatory as well as inhibitory. So 5-HT1, 5-HT2, 5-HT3, 5-HT4, 5-HT, 5-HT1, 2, 3, not 5. 5-HT1, 2, 3. There are three kind of receptors. 5-HT1. And histamine is there. Histamine is also again a biogenic amine. It will have H1, H2 and H3 receptor. Three kind of receptor, H1, H2, H3. 5 histamine जो है 5 hydroxytryptamine उसके 5 होते हैं 5-HT1, 2, 3, 4 and 5. So out of that 5-HT3 is a ion channel, that is a target for anti-emetic drug. So this histamine is a inhibitory in nature, mainly inhibitory. So it is also found in the areas where noradrenaline is there, but it is irregular. Now this was amines. Now second class is known as amino acids. The second class. So in that you have glutamic acid, you have GABA, gamma aminobutyric acid, and glycine is also there. Glycine, gamma aminobutyric acid, glutamic acid, and aspartic acid. So they are found in the CNS and spinal cord. They are excitatory neurotransmitter. They are excitatory. Gamma aminobutyric acid, glycine. GABA and glycine both are found in the GABA is found in mainly in the CNS, glycine is found mainly in the brainstem and spinal cord. Both are inhibitory, the brain as well as spinal cord. Remember, इसके ऊपर कभी कभी क्वेश्चन आ सकता है. Match the following neurotransmitter with their respective chemical structure. Amines कौन से, amino acid कौन से. So this और ऐसे भी पूछ सकते हैं, identify pair of inhibitory neurotransmitter या फिर match the correct pair of neurotransmitter with their respective category, inhibitory, excitatory. So glutamic acid, aspartic acid, they are stimulatory. Okay. GABA and glycine, they are inhibitory. Substance P, third category of neurotransmitter, there is a peptide. ये second amino acid का. First one was the amines, second was amino acid, and third one is a peptide. Okay. So substance P, peptide is, for example, substance P. It is found in the hypothalamus, basal ganglia, dorsal column, and dorsiventral root of spinal cord, and also found in the enteric nervous system. It is excitatory in nature. Target for opioid analgesics. Next one is the cholecystokinin. So it is also found in the brain, cortex, hippocampus, limbic system, and hypothalamus, pancreas. So it will cause inhibition of eating, and stimulation of oxytocin release. The function उसका है release of oxytocin, release of oxytocin. So remember these classification of your neurotransmitters, their chemical class, nature, chemical class, and their functions. इसके ऊपर क्वेश्चन आ सकता है already important है. Next one is a classification of general anesthetics. Now main chapter, general anesthetics. Classification of general anesthetics. First we'll see what is general anesthesia. So what is meant by anesthesia? Anesthesia or okay, reversible loss of pain sensation. That is nothing but the anesthesia. And what is general anesthesia? General anesthesia or general anesthetic drugs are the drug that will lose all the modalities of pain sensation with the reversible loss of consciousness. That is a general anesthesia. And there is another one known as a local anesthesia. So local anesthesia, in that case, there is a reversible loss of pain sensation, but there is no loss of consciousness in case of local anesthesia. So in case of general anesthesia, that is nothing but the general anesthetics are the drug or chemicals that will relieve all the modalities of pain sensation, that will all the modalities of pain sensation. That means आपको पेन नहीं होगा, आपका कट किया कहाँ पे या फिर आपका ऑपरेशन कर रहे हो तो पेन हो गया ना आपको. So that pain will be okay. So that pain will be reduced or that pain will be lost. You will not have sense of pain. So they will abolish, they will end, they will decrease all the modalities of pain sensation with the loss of consciousness. That is general anesthesia, and that's why they are used in the surgery. So anesthesia. The main role of anesthetic has a anesthetic agent or this anesthesiologist has a major role in the operation. इधर उधर एक ml भी हो गए तो आपकी विकेट गई. Classification of anesthesia. Anesthetics are classified into two main categories. First one is a inhalation anesthetic agent and second one is a intravenous anesthetic. First one is a inhalation. In that you have three subtypes: gaseous, liquids, and gases and liquids. You have two subtypes: gases and liquids. In case of gas, nitrous oxide. Okay, nitrous oxide is there. Then enton oxide. Enton oxide is nothing but the mixture of nitric oxide plus oxygen. Then xenon gas is there. These three are the gases. From this nitrous oxide is known as the laughing gas. Is known as the laughing gas. Liquid, for example, chloroform is there. Then trilene is there. Cyclopropane, ether, halothane, N-fluorine, isoflurane, desflurane, sevoflurane, methoxyflurane. Remember these: halothane, N-fluorine, isoflurane, desflurane, sevoflurane. These are the liquid volatile hydrocarbons. Cyclopropane, ether, chloroform. These are the inhalation anesthetic. So now next category is the intravenous anesthetics, or okay, in that mostly short acting barbiturates they are used. Again, intravenous anesthetics are classified into two class. First one is a inducing agent, okay, inducing agent, and second one is a slower acting drug. Inducing agent, for example, thiopentone sodium, and methoxytone, propofol, etomidate, and ketamine. These are known as inducing agent. Thiopentone sodium, methoxytone, propofol, then ketamine and etomidate. Then slower acting drugs. So in that category you have different classes like benzodiazepine. In that you have diazepam, lorazepam, and midazolam. So out of that, midazolam is very popular. Midazolam is a popular one, lorazepam and midazolam. All these are the benzodiazepine derivative. So they will have benzodiazepine ring in the structure. Opioid analgesics. So they are also as an anesthetic agent. So fentanyl is there. Then remi pentyl, supentyl, then alpentanil. All these are the derivative of fentanyl. Neuroleptic drug known as a droperidol, also used along with the anesthesia, droperidol, to induce neuroleptic. This is just classification. We will see it again in the upcoming slide. Remember the classification, which is very important. Inhalation anesthetic agent कौन सा है? Intravenous कौन सा है? उसमें gas कौन सा है? Liquid कौन सा है? Inhalation general anesthetics. So first one is a volatile liquid like chloroform, diethyl ether, ethyl chloride, trichloroethane, halothane, fluorine, isoflurane, desoflurane, methyl fluorine. Gases में आता है आपको cyclopropane, nitric oxide, chloroform. Chloroform is a liquid. And two are no more used. Chloroform and cyclopropane not used. Xenon भी याद रखो xenon. On volatile general anesthetic, they are known as a intravenous anesthetics. That you have ultra short acting barbiturate like thiopentone sodium and methoxytone. Then non-barbiturate like benzodiazepine like midazolam, lorazepam, diazepam. Pain cyclidine derivative like ketamine, or it is a opioid drug, or it is a steroidal drug like pregnenolone. That is a steroidal drug. Other drugs like etomidate, propofol. There are numerous classifications. Okay, classification is different in the different group. Group में अलग अलग classification होता है. Same drug. Okay, so particularly for benzodiazepines and barbiturates, a drug which can act as a different can be have a different action depending on the. So for example, here you can see increasing the serotonin dose, okay, effect of CNS on the y-axis. CNS में इफेक्ट क्या मिलेगा? इधर डोज इंक्रीज होने के बाद इफेक्ट क्या मिलेगा? ठीक है. So suppose the diazepam, take an example of it. So diazepam in a lower dose will act as a sedative. Increase little bit dose, it will act as a anxiolytic. Then if you increase still dose, it can act as an anticonvulsant and muscle relaxant. Okay, so same drug will have a different action by increasing the dose, particularly for the barbiturates and benzodiazepines. Initially, what happen? So initially, it will induce the sleep. Will initially at a lower dose it will cause calming effect, that is sedation. Then after that it can induce a sleep, that is known as a hypnosis. And after still increasing the dose, induce the anesthesia. If you still increase dose, it can cause medullary depression. Means medullary center जो डिप्रेस हो जाएंगे, vasomotor center डिप्रेस हो जाएगा, तो cardiovascular center, then respiratory center, then coma and death. In coma. So this is how the action of dose dependent action of drug. Okay. So particularly barbiturates, they will have dose dependent action. Particularly barbiturates will have dose dependent action. Okay. And as compared to barbiturate, benzodiazepines are little bit safe. Mechanism of action of your general anesthetics. What is the mechanism of action for general anesthetics? So there is one scientist known as Overton and Mayer. Two scientists, they have observation regarding the mechanism of action of general. There is a close relationship between potency of anesthetic agent and lipid solubility. Potency of anesthetic agent and lipid solubility. It is a wrong. Reproducibility नहीं है, lipid solubility. Okay? So they observed that, Overton and Mayer observed that there is a close relation between potency and lipid solubility of drug. So more will be the lipid soluble drug, more will be the potency of anesthetic agent. Evidence says that current evidence suggested that the for general anesthetic, are nothing but the proteins of neuronal ion channel, means receptors, uh, nicotinic receptor 5, serotonin receptor GABA receptors, for IV anesthetics, glycine receptor, glutamate receptor. So currently, whatever general anesthetics you are using, they will act on anything above anything mentioned. They may act on ion channels. They may act on a kind of receptor like serotonin, 5-HT3, then GABA receptor, glycine, glutamate receptor. Particularly IV anesthetics. Now, for this theory is for only applicable for inhalation anesthetics. So, overtone mere observation is only applicable for inhalation anesthetics. Frequency of inhalation anesthetics. So, that is nothing but the minimum alveolar concentration. MAC. What is MAC? It is a measure of potency. But what is meant by MAC? Minimum alveolar concentration. So, it is the concentration of general anesthetics or inhalation general anesthetics in the alveoli produce 50% unresponsiveness in the 50% of people 50% of people do a cut. So मतलब ये है कि minimum concentration of inhalation anesthetic required to produce unreactiveness in the 50% of people who has been given cut. मतलब 50% पीपल में पेन सेंसेशन जाना चाहिए, इतना कॉन्सेंट्रेशन होना चाहिए अल्वियोलर. वो कॉन्सेंट्रेशन क्या है? मिनिमम अल्वियोलर कॉन्सेंट्रेशन एंड इट इज द मेजर ऑफ पोटेंसी फॉर inhalation anesthetic. Okay, so higher will be the minimum alveolar concentration, less will be potency. So कोई ड्रग का अगर हायर कॉन्सेंट्रेशन लग रहा है तो मतलब जैसे एल 50 होता है, ईडी 50 होता है, ईडी 50 में मतलब क्या इफेक्टिव डोज इन 50% पॉपुलेशन. तो वैसे होता है मिनिमम alveolar concentration means concentration of inhalation anesthetic required to produce a unresponsiveness in the 50% people. That is a minimum alveolar concentration, and it is the measure of potency for that inhalation anesthetic. Okay, this was question in GPAT. GPAT में इस क्वेश्चन आया था कि क्या होता है ये, the potency of inhalation anesthetic is measured by minimum alveolar concentration. Important. Then again there is one more term known as a blood drug partition. Blood drug partition. So I have not mentioned over here, but there is another term. I will explain. Blood drug partition. So general anesthetics or inhalation general anesthetics, they are applied in a different cylinder. Different cylinder में उसका supply होता है. Gases. एक क्वेश्चन आ सकता है आपको, color coding for the cylinder. There is a different color for a different gas and to prevent the mismatch, to prevent the mix up. Okay, so color coding for cylinder. Now cyclopropane जो है, that cyclopropane का जो gas है cyclopropane, that is supplied in an orange colored cylinder. So cyclopropane will be supplied in the orange colored cylinder. Normal air that should be supplied in the colored cylinder which is having white कलर का बॉडी होना चाहिए सिलेंडर का पूरा, और उसमें जो शोल्डर है ऊपर वाला जो पार्ट होता है उसको व्हाइट कलर का, ग्रे प्लस व्हाइट, दैट इज फॉर एयर. इन केस ऑफ ऑक्सीजन सिलेंडर का कलर आपने देखा होगा. सो द सिलेंडर इज ऑफ ब्लैक कलर एंड इट विल हैव शोल्डर और व्हाइट नेक. उसके नेक के पास व्हाइट कलर का एक सर्कल रहेगा, पूरा सिलेंडर का बॉडी ब्लैक रहेगा. अगेन फॉर कार्बन मोनोऑक्साइड और कार्बन मोनोऑक्साइड, for carbon dioxide, not monoxide, carbon dioxide, gray color cylinder is used. Gray color cylinder, this cylinder is important. Again, for helium gas, brown colored cylinder is used. Ntox means mixture of carbon dioxide and nitrous oxide. Mixture of nitrous oxide and carbon dioxide. So blue body with white shoulder. Ntox के लिए blue body with the white shoulder. यहाँ पे I think एक मिस हो गया आपका nitric oxide. So it is supplied in a blue colored cylinder. Yeah, it is supplied in the nitric oxide is supplied in the blue colored cylinder. So remember these things, color coding for cylinders. कभी question आ सकता है आपको. And remember here the potency of inhalation anesthetics is determined by minimum alveolar concentration, MAC. Stages of general anesthesia. Stages of general anesthesia. So it was discovered by one scientist known as Goodell. So Goodell in 1920, with referring to a general anesthetic ether, they have described the different stages of general anesthesia. So Goodell has described different stages. So first stage, that is a stage 1, known as a stage of analgesia. Second is known as a stage of delirium. 3 is known as a stage of surgical anesthesia. Stage 3 is known as a stage of surgical anesthesia, and stage 4 is known as a respiratory paralysis. Stage 4 is known as a stage of respiratory paralysis. So taken ether and induced anesthesia and describe the different stages of general anesthesia. So what are these stage? First is known as the stage of analgesia. तो इसमें क्या होगा? Stage of analgesia means so here pain sensation will be lost. First pain sensation will be lost. So inhalation of anesthetic agent to subconsciousness or up to the unconsciousness. Inhalation of anesthetic agent and up to the unconsciousness of patient. So this stage extends from inhalation of anesthetic agent up to unconsciousness. So that is stage first. So what happens in this gradual depression of cortical centers, sensation, loss of sensation, then hotness of sensation, hotness, then falling, suffocation, visual, auditory abrasions. Okay, so in this stage, analgesia is produced. Analgesia is produced before the loss of consciousness. Analgesia means loss of pain sensation. नहीं होगा इसमें. Here you can do minor surgical procedure like incision of abscesses, dental extraction and obstetrical maneuver. मतलब क्या होता है मैं एक्सप्लेन कर दूँ. स्टेज में आप आपका दांत निकाल सकते हो, टूथ एक्सट्रैक्शन. डेंटल एक्सट्रैक्शन मतलब स्टेज में आप दांत निकाल सकते हो. आपको कोई बड़ा वाला जख्म हो गया है, जैसे बॉयल हो गया है, उसको कट करके ड्रेन करना है. सो इंसिजन ऑफ एब्सेसेस, देन ऑब्स्टेटिकल मैन्यूवर मतलब गायनेकोलॉजिकल, जैसे होता है गायनेक में पेन होता है इसका. स्टेज फर्स्ट में क्या होगा? एनाल्जेसिया. रिमेंबर द सेम नेम्स. Stage second is known as a stage of delirium. So what happens in this stage? Loss of consciousness to surgical anesthesia. So this stage 2 of general anesthesia that extends from loss of consciousness of patient up to the surgical anesthesia. Okay. So in this is associated with the excitement, shouting, increase in the muscular activity, then building tachypnea, and hyperventilation. What happens due to this is due to some reason. What is that reason? Due to release of lower center from the control of higher center. तो इसमें क्या होता है? जैसे यहाँ पे एनेस्थीसिया आपने स्टार्ट किया, मतलब जैसे आपने एनेस्थेटिक एजेंट का डोज दिया, तो पहला स्टेज आएगा आपका एनाल्जेसिया. उसका एनाल्जेसिया मतलब पेन सेंसेशन लॉस होगा, लेकिन बाकी सब समझ में आ रहा है उसको. ठीक है, मतलब क्या कर रहे हो, कोई दिख रहा है, कौन आ रहा है, कौन जा रहा है, आप कहाँ पे कट कर रहे हो, सब समझ आ रहा है. स्टेज सेकंड में क्या होता है? डेल्फिन. जैसे उसका डोज एनेस्थेटिक एजेंट का डोज बढ़ेगा तो क्या होगा? सो as you increase the dose of anesthetic agent, so lower centers will be higher center will lose control on lower center. मतलब हायर सेंटर कौन से? हायर सेंटर बोलते हैं those center which are present in the medulla oblongata. Those centers will control lower center. Lower center means those center present in the present near to your spinal cord. So there is a loss of lower center from the control of higher center, and that's why there is a excitement, shouting, increase in the muscular activity. मतलब यहाँ पे चिल्लाओगे, आप मारने को दौड़ोगे, आपके मसल कॉन्ट्रैक्ट होगा. ठीक है, हाइपरवेंटिलेशन मतलब सांस फूलेगा आपका ड्यू टू रिलीज ऑफ लोअर सेंटर फ्रॉम हायर सेंटर. हियर struggling increase the muscle tone and vomiting can occur in this stage. Vomiting also can occur in this stage. So to prevent this, medication is given. We will discuss it later. Stage 3 known as surgical anesthesia. Stage 3 is known as surgical anesthesia. Stage of surgical anesthesia. Now it will extend from the stage 2 to the stage 4. Now what happens in this? Loss of reflexes of skeletal muscle. Okay, लॉस ऑफ रिफ्लेक्सेस. जितने भी रिफ्लेक्स है वहाँ बाकी लॉस होंगे. जैसे आपने वो नी रिफ्लेक्स होता है कि नी में आप वो डॉक्टर मारते हैं थोड़ा सा और नी का रिफ्लेक्स होता है, सो दैट रिफ्लेक्स विल बी गॉन. सो अदर रिफ्लेक्सेस लाइक टच, सेंसेशन, टेम्परेचर, ऑल रिफ्लेक्सेस विल बी गॉन. देन स्केलेटल मसल विल बी एडेक्वेटली रिलैक्स. तो आपके जो स्केलेटल मसल है वो रिलैक्स हो जाएंगे. एंड दिस स्टेज 3 is divided into different planes. Stage 3 of general anesthesia is divided into 4 planes, and surgical procedure is carried out in this stage. पे ही सर्जिकल प्रोसेस आपको करना है. जो भी सर्जरी वो इस प्रोसेस ये स्टेज में करना है. स्टेज 3 divided into different plane. Plane 1 known as plane 1, plane 2, plane 3 and plane 4. Okay? Plane 3 and plane 4. Each and every plane will have loss of one reflex. यहाँ पे एक या दो रिफ्लेक्स कम हो जाएंगे. सो इन द प्लेन प्लस जैसे जैसे कॉन्सेंट्रेशन बढ़ता है आपका एनेस्थेटिक एजेंट का, प्रेजेंस ऑफ कॉर्नियल रिफ्लेक्स. पे कॉर्नियल रिफ्लेक्स होगा, मतलब जैसे जैसे लाइट आपके आईज में जाएंगी तो आपका आई कांटेक्ट होगा। सो पिपिलरी रिफ्लेक्स जो होता है कॉर्नियल रिफ्लेक्स वो रहेगा, यहाँ पे लॉस नहीं होगा उसका। लॉस ऑफ कंजक्टिवियल रिफ्लेक्स, कंजक्टिवियल रिफ्लेक्स जैसे आपके आईलिड है, आपके आँख के सामने उंगली लेके जाएंगी तो आप ऑटोमेटिकली आँख बंद कर दोगे, दैट इज नोन एज अ कंजक्टिवियल रिफ्लेक्स। Corneal reflex is present but conjunctival reflex is lost. As the concentration will increase, patient will enter in the plane segment. So here reflex of larynx is also absent. So इसके बाद में बाकी के रिफ्लेक्स धीरे धीरे कम हो जाएंगे, लैरिंक्स के रिफ्लेक्स कम हो जाएंगे, यहाँ पे रिफ्लेक्स जाएगा। प्लेन 3 में क्या होगा, pupillary light reflex and corneal reflex are lost. तो corneal reflex and pupillary reflex जो प्रेजेंट था आपके प्लेन फर्स्ट में, corneal reflex corneal, so that will be also lost in the plane 3। मतलब आग 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 जो आपका कॉर्निया के ऊपर लाइट गिरेगा तो कॉन्स्ट्रिक्शन रिलैक्सेशन नहीं होगा, दैट मीन्स पिपिलरी रिफ्लेक्स इज लॉस्ट, कॉर्नियल रिफ्लेक्स इज लॉस्ट एंड अप टू दिस स्टेज पेशेंट इज अलाइव। यहाँ यहाँ तक पेशेंट जिंदा होता है, जैसे ही कॉन्सेंट्रेशन बढ़ गया यहाँ से नीचे गया पेशेंट की विकेट गिर गई, पेशेंट गया स्वर्गलोक में। प्लेन 4 is known as a paralysis of intercostal muscle, dilation of pupil and loss of reflexes। होगा paralysis of intercostal muscle। So intercostal muscle that is the muscle responsible for the respiration। जो आपके thoracic cage है उसके जो बैक मसल है आपके और abdominal मसल है तो they are known as intercostal muscle, or the muscle present in the viscera, visceral organ, they are known as intercostal muscle। जैसे आप सांस लेते हो सांस छोड़ते हो, so that is because of the movement of intercostal muscle, movement that is contraction and relaxation। Okay, now plane 4 में that is a paralysis of intercostal muscle and dilation of pupil, loss of all kind of reflexes, that means plane is that means patient is gone। Okay, so stage stage 4 is known as a stage of respiratory paralysis। यहाँ पे respiration totally आपका stop हो जाएगा stage 4 में, patient will die। So respiratory arrest and paralysis, respiratory arrest and paralysis stage will never come because in a modern anesthetic practice, in a modern anesthetic practice this stage never come because of the balanced anesthesia। anesthesia technique अभी आजकल बहुत ज़बरदस्त हो गया है, that's why ये मरेगा नहीं पेशेंट। तो anesthesia anesthetic एजेंट बहुत ही मतलब anesthesiologist का बहुत ही काम इम्पोर्टेंट होता है, बिकॉज इधर उधर 1-2 ml हो गया। तो स्टेजेस समझ में आया, आर यू गेटिंग और नॉट, बोला। नाउ नेक्स्ट वन इज इनहेलेशन एनेस्थेटिक्स। इनहेलेशन एनेस्थेटिक इन शॉर्ट, एक का प्रॉपर्टी अलग अलग होता है, एडवांटेजेस डिसएडवांटेज अलग अलग होता है, लेकिन मैंने थोड़ा सा यहाँ पे आपके लिए थोड़ा सा यहाँ पे। सो अगेन इनहेलेशन एनेस्थेटिक्स, तो इनहेलेशन एनेस्थेटिक्स में कितने ड्रग्स है और उन ड्रग का क्या क्या इफेक्ट है। फर्स्ट वन इज नोन एज डाईइथाइल ईथर, डाईइथाइल ईथर। So in short, it is a curare mimetic. It is a curare mimetic means it will cause muscle relaxation, satisfactory muscle relaxation. It is inflammable, मतलब ये आग पकड़ सकता है, inflammable and explosive, and also it is irritant to your respiratory system. It can it can have cross tolerance with ethyl alcohol and may cause convergence, especially in the children। ये epilepsy कर सकता है children में, diethyl। Next one is a halothane। Halothane means okay, it will increase the intracranial tension, it can increase the intracranial tension due to vasodilation in the cerebrum। इसका disadvantage है microsomal hepatic enzyme inducer है, इसका metabolism बढ़ जाएगा, can cause hypotension and cardiac arrhythmia। drawback, it is as a bronchodilator and hepatotoxic, n-fluorine and isoflurane, n-fluorine and isoflurane, so can decrease the myocardial contraction rate, means they are also cardiac suppressant except isoflurane। isoflurane नहीं है, so you can consider as a isoflurane is a ideal anesthetic agent, you can consider। n-fluorine has a highest respiratory depression, they both are non-inflammable, good muscle relaxant and are considered as a near to ideal anesthetic agent, they are prepared for neurosurgery, they are prepared for ethyl chloride is no more used, ethyl chloride is used only locally, trichloroethylene is also, it is also potent analgesic muscular relaxant। muscular relaxation is not, muscle relaxation is inadequate, पूरा muscle relaxation नहीं करेगा। It has been used as a self medication for analgesic during labor pain। सेल्फ मेडिकेशन बोल के भी यूज किया जाता है. And next one is the gaseous anesthetics. Gaseous. So in that we have nitrous oxide. Nitric oxide is known as a laughing gas. Nitrous oxide is known as a commonly administered together with the oxygen. Okay, oxygen and ether. Ether, oxygen and nitrous oxide. ये तीनों का combination use करते हैं. So and it is known as GOE technique. It is known as a GOE technique. So G means nitrous oxide gas, oxygen and ether. 80-20 mixture of nitrous oxide, oxygen can be used for anesthesia. So excitement, it can cause excitement and it can cause excitement which are violent. ज़्यादा excitement कर सकता है patient में, which is violent. It has a maximum MAC. It has a maximum MAC. Maximum MAC means maximum alveolar minimum alveolar concentration. इसका anesthesia के लिए क्या है? Maximum alveolar concentration है. It has a maximum MAC. That's why it is a least potent. जिसका maximum MAC required होता है anesthesia के लिए, that is a least potent. And जिसका minimum में होता है, that is a more potent. It has a maximum MAC, minimum alveolar concentration. So that's why it is the least potent. But potent कौन सा है फिर? Potent है आपका methoxyfluorine. Methoxyfluorine is the most potent. It is having least MAC. It is having least minimum alveolar concentration required to produce an anesthesia in 20%. So remember these things. ये important है आपका. तो आपको वो जो स्टेजेस के ऊपर क्वेश्चन आ सकता है, ऑलरेडी आ चुका है. डिफरेंट स्टेज 1 क्या होता है, स्टेज 2 क्या होता है, इसमें कौन सा रिफ्लेक्स जाता है. और ये बाकी इनहेलेशन हो गया आपका इंट्रावेनस एनेस्थेटिक्स. सो इंट्रावेनस एनेस्थेटिक्स. सो फर्स्ट वन इज थायोपेंटल सोडियम. Thiopentol sodium. It is nothing but the short acting barbiturates. So when we'll see sedative hypnotic chapter, at that time we'll see each and everything about the. It is a highly lipid soluble drug. It has a short duration of action, a highly lipid soluble drug, and it can cross placental barrier, and the drug can be secreted. It can appear in the milk. It depresses the respiratory center. It is a poor analgesic and muscle relaxant. So ideally anesthetic agent में क्या होना चाहिए? It should be a good analgesic and good muscle relaxant. It is a poor analgesic and muscle relaxant. It can precipitate acute attack in acute intermediate porphyria. Acute attack in acute intermediate porphyria. ये क्या होता है? ये छोड़ो, मतलब ये आपका टेम्परेचर वगैरह बढ़ा देंगे. Should be used cautiously in case of renal hepatic damage, and it can be used cautiously in case of hepatic damage, renal damage, shock, bronchial asthma, and cardiovascular disease. It is a drug of choice in the cerebral protection. ये क्या drug? Next one is a midazolam. Midazolam is a benzodiazepine derivative. It is short acting benzodiazepine derivative. Next one is ketamine. Ketamine is a N-methyl deacetate agonist. NMDA agonist. It is related to phencyclidine. It is a derivative of narcotic analgesic. It can induce a state of dissociative anesthesia. इसके ऊपर भी क्वेश्चन आ रहा है. The drug which are used to induce the dissociative anesthesia. भाई dissociative anesthesia क्या होता है? Dissociative anesthesia. Ketamine is used to produce dissociative anesthesia. By other anesthetic agent, you see, so you lost all the consciousness. Consciousness loss हो जाएगा, आप मतलब सो जाओगे पूरा, कुछ समझ में आएगा. So you will not remember what happened in the operation theater. टांग किसने काटी या फिर आपका जो भी है किसने काटा, जख्म साफ किसने किया, स्टिचेस किसने लगाई, आपको कुछ भी याद नहीं रहेगा. During other anesthetic agent, but if you use ketamine, so it will produce dissociative anesthesia. That means patient is able to see each and everything. Patient can see each and everything. सब कुछ देख रहा है वो. एक बड़ा सा औजार लेके आया डॉक्टर, मेरा टांग काट रहा है, वो भी देख रहा है उसको रोना भी आ रहा है, समझ भी रहा है उसको क्या कर रहा है, उसको रोना भी आ रहा है, रोएगा वो, बड़े से नहीं, उसकी आंखों से आंसू. लेकिन क्या होता है कि उसको रिस्पॉन्सिवनेस कुछ भी नहीं होगा. सो पेशेंट इज एबल टू सी ईच एंड एवरीथिंग व्हाट इज गोइंग इन द एनवायरनमेंट, बट इज नॉट एबल टू रिस्पॉन्ड टू एनीथिंग. दैट इज नथिंग बट द डिसोसिएटिव. द पेशेंट इज डिसोसिएटेड फ्रॉम द एक्सटर्नल एनवायरनमेंट. That is known as a dissociative anesthesia. It is characterized by complete analgesia compared with amnesia, accompanied with amnesia. It can cause cardiovascular and respiratory depression, and it is used to produce dissociative anesthesia. Sometimes can cause involuntary movement of hypotenuse, involuntary movement of hypotenuse, can cause delirium, hallucination. Barbiturates and benzodiazepines are chemically incompatible with the ketamine. Ketamine अगर देना है तो इसको यूज नहीं करना है. Next one is etomidate. Etomidate. So it is a carboxylated imidazole derivative. Is a potent hypnotic and anesthetic agent. Cardiovascular stability is advantage of this one. ये बाकी के comparison में cardiovascular का depression कम करे. And it is primarily used in the induction of anesthesia in aneurysm surgery. Aneurysm surgery मतलब जैसे आपका bypass surgery. So there is a type of aneurysm surgery. Cardiac disease. Cardiac disease वही maximum वही होता है. So aneurysm surgery means किसी blood vessel में block है को remove करना है. जो anesthesia that is known as aneurysm surgery. Again, this use of this drug is associated with the vitamin C deficiency. It can develop vitamin C deficiency. Next one is a propofol. Rapid induction and rapid recovery and small hangover has a specific anti-emetic action. It is a safe during pregnancy. Propofol is a safe during pregnancy. It cannot cross placental barrier. It will not depress the respiration of fetus like thiopentol. Thiopentol can cross the. It also has an anti-emetic action. Then Pregnenolone is a nothing but the steroid in nature. It is a steroidal anesthetic agent. याद रखो कौन सा क्या है. Phencyclidine derivative is nothing but the ketamine. Phencyclidine derivative. Midazolam is a benzodiazepine derivative, short-acting benzodiazepine. And ketamine is a phencyclidine derivative. It is related with the narcotic analgesics. And this pregnenolone is a steroidal in nature. So here naturally occurring metabolite of 7-alpha hydroxyprogesterone, 3 times more potent than propranolone. Then next one, what is neuroleptic analgesia? Combination of neuroleptic drug with anesthetic drug is nothing but the neuroleptic analgesia. So anesthesia, this was question in GPAT. So it is a method of intravenous anesthesia in which there is a combination of neuroleptic drug with opioid analgesic drug. It is a neuroleptic analgesia. So the most favorite combination is being droperidol 2.5 mg plus opioid analgesic fentanyl. So this is the one of the most favorite combination for neuroleptic analgesia. Then pre-anesthetic medication. What is pre-anesthetic medication? So pre means before anesthesia. Before the anesthesia, whatever medicines are given, that is nothing but the pre-anesthetic medication. But why you have to do this pre-anesthetic medication? For example, you know that stage second is known as a delirium. स्टेज सेकंड में क्या होता है कि मसल कॉन्ट्रैक्शन करता है, फ्रॉथिंग होता है, मुंह में से चाक आना, खूब सारे रोता है पेशेंट, उसका सलाइवरी सिक्रेशन सब सिक्रेशन बढ़ जाता है, नीचे से ऊपर से सब में सिक्रेशन आता है, ठीक है, वोमिटिंग होता है, उसका डायरिया हो सकता है, उसको प्रिवेंट दीज सिम्टम्स. सो प्री एनेस्थेटिक मेडिकेशन इज गिवन फॉर एग्जांपल टू अचीव अ सर्टेन लेवल ऑफ एनाल्जेसिया, to reduce the excitement, to decrease the anxiety of patient, to reduce the secretions, so to suppress the vomiting center. So pre-anesthetic medications are used. So for sedation, to reduce the anxiety, apprehension, to obtain the additive effect or synergistic effect, to counteract the certain adverse effect of anesthetic drug like salivation, bradycardia, vomiting, to relieve pre and post-operative pain, to suppress the respiratory secretion, to reduce the reflex excitability. Now drugs used as a pre-anesthetic medication, they are nothing but the first one is a opioid analgesic, for example morphine, then ethidine, sedative, hypnotics and tranquilizer, diazepam, nitrazepam, phenothiazines and butorphanol. Then antimuscarinic like atropine, glycopyrrolate, they are more commonly used. Then neostigmine, antiemetic drug like metoclopramide, then phenothiazine, promethazine, benzamide, cyclizine. Drug administered during anesthesia. ये हो गए प्री एनेस्थेटिक मेडिकेशन. These are the pre anesthetic. Opioid analgesics, hypnotics, antimuscarinic drugs and antiemetic drugs. They are geared to the induction of anesthesia so that the anesthesia will be smooth. वोमिटिंग ना हो पेशेंट के लिए, उसके लिए आर्ट्रोपिन देंगे पहले या फिर ग्लाइकोपायरोलेट देंगे, सिक्रेशन ना हो इसलिए ग्लाइकोपायरोलेट देंगे, आर्ट्रोपिन देंगे, तो पेशेंट डर ना जाए इसलिए डायजेपम पहले उसको, जैसे आप वो जनरल वार्ड में है उसको क्या करना है कि रूटीन डोज दे देना उसका डायजेपम का, पहले से वो सेडेशन में जाएगा, थोड़ा सा सेडेशन में गया तो उसको समझ में आएगा कहाँ लेके जा रहे क्या कर रहे. नहीं तो होता है ना पेशेंट, कई पेशेंट होता है उसको बोला ना तेरा ऑपरेशन है तो वो उधर ही मर जाता है. Pre-anesthetic medications are given. Opioid analgesics, morphine administered during during the anesthesia, skeletal muscle relaxant and short-acting ganglionic blocker are used to achieve adequate muscle relaxation. Succinylcholine and D-tuberculin. Succinylcholine is a मसल पैरालाइजिंग। आपने एक मूवी देखा होगा फैंटम, उसमें फैंटम मूवी में सैफ अली खान जो है वो जो टेररिस्ट होता है पाकिस्तान में, उसको जाके ये सक्सेल को सॉरी वो जो डेविड हेडली होता है जेल में उसको मार डालता है बाय यूजिंग सक्सेल। इट इज अ पैरालाइजिंग एजेंट। डी ट्यूबरकुलोसिस इज आल्सो ए मसल रिलैक्सिंग एजेंट और पैरालाइजिंग एजेंट, नॉन डिपोलराइजिंग मसल रिलैक्सेंट। उसके ऊपर एक पूरा चैप्टर है मसल रिलैक्सेंट, हम देखेंगे। So this was all about the this general anesthetics. Now I will explain certain things from books also. So there are certain points which are also important, particularly from this book. Are you able to see the screen? Screen दिख रहा है क्या आपको? Hello. So general anesthesia. The aim of general anesthesia, there is nothing but the general anesthesia means loss of reversible loss of pain and consciousness. That is a general anesthesia. Local anesthesia means consciousness is not lost, consciousness is maintained. In case of general anesthesia, loss of consciousness is there along with the loss of pain sensation. So loss of pain sensation along with the loss of your consciousness in case of general anesthesia. In case of local anesthesia, consciousness is retained. Okay. Now unconsciousness means muscle relaxation. Conscious loss हो जाएगा, you will become unconscious. So there will be muscle relaxation. So unconsciousness, muscle relaxation, analgesia, abolition of compensatory reflex. These are the aims in the in anesthesia. Now we have seen the classification. We have seen the classification, color coding also. Remember color coding. Nitric oxide will have nitric oxide cylinder will have blue color. Cyclopropane will have orange color. Okay. Gray body with white shoulder. Then oxygen will have black body. Oxygen bucket. Oxygen will have black body with white shoulder, and carbon dioxide will have grey color cylinder, helium gas will have brown color cylinder. तो ये helium gas यूज थोड़ी करते हैं इसलिए उसको नहीं दिया है. Okay, intox means 50% air plus nitric oxide, blue body with white shoulder. From alveolar concentration that will determine the potency of your general anesthetic agent. It is a minimum concentration of inhalation anesthetic required in alveoli to produce unresponsiveness to the skin incision in a 50% patient. मतलब क्या minimum alveolar concentration कैसे calculate करते हैं? Amount of that inhalation anesthetic required to produce unresponsiveness. मतलब आपको स्किन के ऊपर कर देंगे, अगर आपको रिस्पॉन्स आ गया, कॉन्सेंट्रेशन नहीं आया है, अगर आपको रिस्पॉन्स नहीं आया, मतलब मान लीजिए आपने 20 पेशेंट ले लिए, तो 20 पेशेंट में स्टडी करना है आपको, कितना लग रहा है एनालिसिस करने के लिए unresponsiveness. Okay, responsiveness in 50% patient. Measure of potency of greater the MAC, lower will be the potency, and lower will be the MAC required to produce anesthesia. So it will have greater potency. Nitrous oxide is gas with maximum MAC and least potent. That's why it is the least potent, and its MAC is around 140. In pure form, its MAC is less. Then methoxyfluorine is the most potent. ये दोनों भी lines important है, most potent कौन है, least potent. Then again, blood gas coefficient is another measure. Blood gas coefficient is another measure. So it is determined by solubility of anesthetic agent in the blood. तो आपका anesthetic agent blood में कितना soluble है? That is a measure of your blood gas partition coefficient. It determines the speed of onset and recovery of anesthetic. Anesthesia कितने टाइम में चलेगा और कितने टाइम में पेशेंट वापस आ सकता है. That is nothing but the determine the speed of onset and recovery of anesthesia. कौन है? So greater will be the blood gas partition coefficient, less will be the speed and onset of recovery and vice versa. So ज़्यादा अगर partition coefficient है तो उसमें क्या होगा? Onset of anesthesia will be less and recovery will be less. एक 10-15 मिनट. So remember over here, desflurane is the fastest acting general anesthetic because it has a minimum blood efficient. Methoxyflurane is the slowest acting because it has a maximum blood gas partition coefficient. Okay, ये important है point. बाकी इधर का वगैरह छोड़ो, बाकी advantages disadvantages क्या है. Again over here, एक चार्ट में भी दिया है। तो methoxyfluoridone will require least MAC, least minimum alveolar concentration at atmospheric pressure. Then again इस बुक में थोड़ा सा xenon के बारे में दिया है। Xenon is a gas. Okay, it is also used as anesthetic. So xenon के बारे में दिया है। So it will have highest, this will have, xenon will have again higher minimum alveolar concentration. यहाँ पे lowest minimum alveolar concentration किसका है? Methoxyfluoride. Okay, that's why it is the most potent. Then again यहाँ पे अगर blood gas coefficient किसका मिनिमम है? जेनॉन का। ये जो है ब्रीदिंग टेक्निक, ये इंपॉर्टेंट नहीं है, छोड़ दो। रेस्पिरेटरी सिस्टम, तो यहाँ पे जो इनफ्लुएंस है दैट विल कॉज मैक्सिमम रेस्पिरेटरी डिप्रेशन। देन इनहेलेशन एनेस्थेटिक एजेंट causes bronchodilation and thus increase the anatomical dead space. Maximum bronchodilation is seen with the halogen. Bronchodilation. Inhalation anesthetic agent, they can reduce the cardiac output. Okay, isoflurane and desflurane. They are suppression except desflurane, isoflurane. Maximum cardio suppression is seen with the enflurane. Enflurane सबसे ज़्यादा कार्डियो को हार्ट को डिप्रेस करेगा. Will also reduce the blood pressure. अगर कार्डियक मतलब हार्ट को डिप्रेस करेगा मतलब ब्लड प्रेशर भी रिड्यूस करेगा. Maximum reduction in the blood pressure is seen. The contradictory statement है, देखो यहाँ पे कार्डियक आउटपुट एक्सेप्ट, लेकिन वही क्या करेगा? Reduction in blood pressure. Inhalation agents are good skeletal muscle relaxation except nitrous oxide. Maximum muscle relaxation is caused by nitric oxide. ये properties, nitric oxide is known as a laughing gas. सिलेंडर का कलर कौन सा है? ब्लू. एनालिसिस के हाईएस्ट MAC है, तो लिस्ट को 2-3 बार हो चुका है. इंटॉक्स नीचे तो 50% नाइट्रिक ऑक्साइड का एक प्रॉपर्टी दिया है इस बुक में, एक बार पढ़ लो आप, दैट विल बी ओके फॉर यू. इट इज अ रिव्यू ऑफ फार्मेसी बाय गुप्ता एंड गर्ग. रिव्यू ऑफ फार्मेसी